Hello and welcome to today's Essential Together Huddle, staff training to support family-centered care during COVID-19 and beyond. I'm Shoshana Hahn Goldberg, a Senior Improvement Lead with the Patient Engagement and Partnerships team at Healthcare Excellence Canada, and I'm pleased to be your host today. Please note that this session is being recorded. We are pleased to offer this webinar with simultaneous interpretation. If you'd like to hear the voice of our interpreter today, please select French from the interpretation menu at the bottom of your screen. We invite you to use either official language to share your questions, ideas, and comments in the chat throughout today's session. I'd like to start by acknowledging that we are meeting on the land that has been inhabited by Indigenous people since the beginning. In particular, we acknowledge that we are broadcasting this huddle from Ottawa, which is the traditional and unceded territory of the Algonquin Nation. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. If you have not yet done so, please take a moment now to respond to the 3 poll questions on the screen. Please scroll down to see all the questions in both English and French. Be sure to click Submit to send your responses to us. As I introduced our guest speakers, I'd ask that you please take a moment to introduce yourselves in the chat box and where you are joining us from today. It's my pleasure to introduce the presenters from Caregiver Care and Covenant Health. Dr. Jasneet Parmar is a care of the elderly physician and has worked for the Specialized Geriatrics program since 1992. She's an associate professor, Department of Family Medicine, University of Alberta. She's the medical lead of Home Living and Transitions, AHS Edmonton Zone. Jasneet has been very active in developing and implementing clinical programs for the care of the elderly with complexity and frailty. Her research currently is focused on supporting family caregivers of older adults by the healthcare system. Cecilia Marion is Senior Director of Operations within the Addictions, Mental Health, and Continuing Care portfolio of Covenant Health, supporting Youville Home and St. Joseph's Auxiliary Hospital. She holds a strong belief that individuals and their families need to be equal partners in the care relationships within our health system and our communities. Her latest exciting achievement is the Family Involvement Initiative, which focuses specifically on improving the involvement of families in the care of individuals living in long-term care. We also have our producers and offer our great appreciation to them for getting us on air today, Gina Peck and Kelly Ripley, who are operating behind the scenes today. Thank you. Welcome to all of you, and especially warm welcome to patients, residents, families, caregivers, and essential care partners who are joining us today. Essential Together huddles are intended as a safe space to share what you're learning about the work you have been doing and what you have been experiencing. It's an opportunity to connect people who have different roles of the health and care sectors, would bring different perspectives and experiences and come from different care settings, but with a shared focus on safely welcoming back caregivers as essential care partners. Next slide. Healthcare Excellence Canada is the newly amalgamated organization that has brought together the Canadian Foundation for Healthcare Improvement and the Canadian Patient Safety Institute with a relentless focus on improving healthcare with and for everyone in Canada. In today's session, I will provide a brief overview of the Essential Together program. You're going to hear how the Caregiver Care staff training courses were developed and how they are being used to support essential care partners. And our goal with these huddles is the opportunity for us to share what is happening across Canada and to learn with and from each other. So what is Essential Together? Essential Together is a program developed in response to what has been happening during this time of COVID-19, but has implications well beyond this time of pandemic, to support the safe reintegration of essential care partners into health and care settings during this time of pandemic and beyond. There are 3 specific audiences for this program: policymakers, those who implement policy, and those that are impacted by policy. The focus of these national huddles concentrates on actions to implement the policy guidance. We use the language of essential care partner, but do know that different language is used across the country. such as designated caregiver, designated care partner, essential visitors, etc. So how can we safely reintegrate essential care partners? Last summer, we hosted a policy lab bringing together a range of stakeholders, policymakers, healthcare leaders and administrators, patients and caregivers to understand the ideal journey for caregivers to safely re-enter health facilities. Based on this journey map, we co-developed policy guidance that focuses on two main areas: identification and preparation of essential care partners, and entry into facility. There are 7 components to the policy guidance, and today we are learning more about the important component of establishing staff training. That is, providing training to support staff so they feel comfortable and safe supporting patients, residents, clients, and whomever they identify and designate as important to participate in their care together. The national huddles will focus on different elements in the coming sessions. At the core of the policy guidance and for the Essential Together program are 3 foundational principles: recognition and acknowledgement of the essential role that families or other caregivers play as essential care partners, the ability to differentiate this role that is essential from that of visitor, and to engage with patients, residents, clients, as well as families, caregivers, essential care partners to implement new policies and practices. As a program, we want health and care organizations to commit to the call to action. There's an Essential Together tool to support reflection of the 7 key elements of policy guidance. We have learning bundles for each element of the guidance with curated resources and tools. And peer learning like these huddles are in place, and we also offer additional coaching for teams to support implementation. Before I hand it over to Jasneet and Cecilia, we will just see if there are some quick poll results to look at. And it does not look like there are, so I will now hand it over to Jasneet and Cecilia to share with us their work with caregiver care. As a reminder, please use the chat box to share your thoughts, comments, and questions, which we will get to after the presentation.
Thank you, Shoshana. So we'll get started. We have a little bit of time to do a presentation, and Jasneet and I just want to take you through a bit of our experience as we try to respond and build something that would support the staff in the care centers, whether it's hospital, long-term care, in terms of managing and developing good relationships with the essential caregivers. So it's been about 21 years since Ray Romano spoke in The Future of Healthcare, where he focused on saying that, the Canadian healthcare system would not be sustainable without the support of the unpaid work that family caregivers provide. And I know for myself, I've been a caregiver for my father-in-law who was dying of cancer, but I've also worked in the school system with families who have children with disabilities, and the work that they do in providing care, in long-term care, in social services. And there's just the amount of support that families give it's really quite unbelievable. And so today what we want to do in our presentation is, you can change the slide. We just want to talk about why educate the healthcare workers in the workforce, talk about the co-design, caregiver-centered education, talk a bit about what was developed by our co-design team, and actually talk about the education to facilitate staff and family caregiver partnerships. So we can start with, why educate healthcare, healthcare workers around the support of caregivers. And I think, one of the things for building trust in a relationship is to really seek to understand things from each other's perspective. And it is really important that our staff and anybody that works with caregivers has a respect and understand what they do provide. And so this slide kind of demonstrates that. It speaks to 1 in 4 Canadians are family caregivers, and they're often referred to as the shadow or invisible workforce. 25% of Canadians are family caregivers, and they provide 75 to 90% of the care to people needing care in community. And pre-COVID, where assistance was at about 30% in long-term care centers. Now, when COVID hit, our first response was to really close down the doors of the centers and not allow families in. Which I think was a huge learning for all of us, that if we were to go through another pandemic, that's not where we would go. I don't think it was helpful for the family caregivers or the people living in the centers. And in the end, it wasn't helpful for the staff either. When I think about our center moving towards, everybody having their meals in the dining room, and then all of a sudden being on an outbreak and everybody being in their rooms on tray service, it was very difficult to support all our people to get meals that were warm. The caregivers provide 10 times more than paid caregivers. So you think about our staff, well, family members provide 10 times more support than the staff do. And using the 2012 Stats Canada GSS, Dr. Janet Fast from the University of Alberta valued that contribution of $66.5 billion was provided by family caregivers. So you can switch the slide. And this slide just speaks to the struggle with COVID. So COVID-19, created a lot of loneliness and isolation, and really defeated the position of the family caregiver who was already struggling. So when we shut the doors and moved them, kept them out from coming into the center, it really was hard on the people that lived there, and it was hard on the caregivers. I know that in the beginning, it might have felt like it devalued the position of the family caregiver, but I think in the end, what we're seeing is there's a recognition of the importance of the family caregiver. As Jasneet will tell you, this initiative started because she and Dr. Jana Holyrood-Leduc, Dr. Leslie Charles, care of the elderly physician, and Dr. Suzette Primalt Phillips, an OT, who was working on reducing antipsychotic use in long-term care in Alberta, were aware of the rising stress and anxiety in family caregivers that they were interacting with. And they recognized that we all needed to do something to try to build that relationship and between the caregivers and those working in healthcare. You can switch the slide. So this is just a graph that shows the rise in loneliness and the rise in anxiety. So as you can see, both loneliness and anxiety were rising before the COVID-19 pandemic. In the pandemic, 85% of Alberta family caregivers were lonely, and 54% were anxious. We often hear about family caregiver burden. However, anxiety and loneliness are better measures to connect to well-being. Feeling lonely is linked to the risk of depression, dementia, poor self-rated health, and premature mortality. Loneliness carries the health risk as much as smoking 15 cigarettes a day. It is twice as harmful to health as obesity, and the risk of premature mortality is as lethal as alcoholism. we humans are relational, and we need to continue to be in relationship even when, we're going through something like the pandemic. Anxiety typically rises as care responsibilities increase and energy depletes. And I know, even for myself, as COVID was happening, and that people were getting more stressed out, I was getting more stressed out, and I was getting more and more tired. You can feel your health become compromised. So we just really need to make sure that we are recognizing how our caregivers are doing. And I know Jasneet was part of creating an assessment for caregivers. So, just encouraging, even within our center, encouraging us to have conversations with our caregivers as much as the people that we're caring for, to ensure that they're doing okay and what can we do. And I really love it when our staff will come to us and say, so-and-so's wife is looking really tired when she comes into the site, or she's not remembering things. So, we right away rally around that person and make sure that they are doing okay, and what other kinds of things can we do to support them. Okay, you can switch this slide. So in trying to look at education for our staff, when I started the Family Involvement Initiative in our center, one of the first things I did was survey both the residents, the families, and the staff to see whether they thought this initiative was a good idea, what some of their worries were, and what did we need to focus on. And certainly from our staff's perspective, one of the things they talked about was they were actually, some of them, fearful to have conversations with families, that families would ask questions they couldn't answer, or because many of our staff, English is their second language, they were fearful of not being able to communicate with our family caregivers in a good way. So when you look at Codesign, it's really looking at all the stakeholders that are involved and ensuring that they have a voice in designing something that's going to be helpful for them. So I think Jasneet and her team did an amazing job of pulling together feedback from staff, feedback from all types of caregivers. So people that work with seniors, people that work with children, other professionals within the community, other people who are providing education, professional associations that support, nursing or our allied health people, and really looked at getting their input into designing education that would support staff to have better relationship with our caregivers and be able to support our caregivers in whatever environment they were working in. I'll pass it on to Jasneet.
Thank you, Cease. And I want to apologize if you hear some noise. I do have construction going on in my neighborhood, so hopefully it won't be too noisy. I want to also thank Cease for being an extremely valuable partner in what I'm going to share with you shortly. And I also want to acknowledge Sharon Anderson, who is our research coordinator. She's online, and she's really the wind beneath the wings of this initiative. So thank you, Cease. Thank you, Sharon. And thank you, Shoshana, for giving us this opportunity to speak at this. I truly like to believe a momentous time in the lives of family caregivers. And hopefully with what you're trying to achieve and what all of us in various provinces are trying to do, we will truly make a difference going forward in supporting family caregivers of people of all ages. Though I'm a care of the elderly physician, the work I'm going to share with you has included caregivers of all ages and care recipients of all ages. This work began in 2014, and right from get-go, we've used a co-design process. And now in the last 7 years, we've had over 400 multiple stakeholders from various settings and services, and Cease described many of them who've been engaged in this work. And really, for the first few years, all we were doing was turning over rocks. We really did not know. We knew it was an issue, but we really did not know of the role healthcare system should be providing in supporting family caregivers. Our thoughts at the time were mainly patient-centered, and families were means to an end, more or less, and that community and society and government supported family caregivers. However, the very first 3 consultations, and these were mega meetings, over 120 people for each consultation meeting, well, what we heard was that we have missed an opportunity within the healthcare system to support family caregivers. And a lot of the voices we heard, a lot of the heartbreak we heard was when family caregivers interacted with the healthcare providers within the healthcare system. And the general message that we came to understand was that the healthcare system was not overly supportive of family caregivers. It was focused on patient care. So it took us a few years to get to the point of synthesizing this information and also looking for opportunities. Now, where do we go from here? And in 2018, then finally, we pulled all this together. And there's a paper on this, and we looked at the domains which, if we were within the healthcare system, if we serve these well, family caregivers would feel supported. And then in 2019, we validated our competency framework. And again, this is published. And I'll share this competency framework, which is based on these competency domains. And then next year, we actually got into the business of developing the education that would serve these competency domains. And finally, in the fall of last year, we launched our foundational education, and then quickly went on to develop, because by that time, pandemic hit, and it was, this work was prescient. You know, we did not know pre-pandemic that this work would become so valuable during the pandemic. What we were already trying to do was just further enhanced by what we were hearing across the country and in Alberta. And in this year, we continued to spread and scale the foundational education, as well as we have released a COVID module for healthcare providers to support family caregivers during the pandemic. And both the modules have been rated very highly. Next slide, please. So we keep referring to caregiver-centered care, and perhaps it's a little bit confusing because we talk about patient and family-centered care in our healthcare system. But we intentionally, with the input from the multiple stakeholders, coined this term and a definition to go with it, because patient and family-centered care does take into account families. However, it isn't particularly focused on the needs of the family caregivers. It's still focused on the needs of the patient, and family caregivers are expected to fulfill those expectations. So what is caregiver-centered care? Simply put, it's person-centered care for family caregivers. And the definition, which was accepted by our multiple stakeholders and now has become part of our working document, is that it is a collaborative working relationship between families and healthcare providers in supporting family caregivers, not only to sustain their caregiving role, but also in maintaining their own health and well-being. And of course, now we've heard a lot more about the need to partner with family caregivers, involve them in decision-making about services, in care management, and support their advocacy. Next slide, please. So what is this competency, caregiver-centered care competency framework? Well, it consists of 6 domains, and they are presented in a circular manner because they all support each other. They complement each other. And you'll notice right off the bat, we have recognizing the caregiver role. And this was pre-pandemic. And during the pandemic, it became even more transparent that there is a difference between families and family caregivers. There's a difference between visitors and essential care partners. And this particular domain speaks to recognizing who family caregivers, the people who actually provide care in the presence of illness, disability, mental illnesses, physical illnesses, and age-related needs. So you may have a big family, but you may have a few people who are actually providing the support. And those are the people that we want to bring to the attention of the healthcare providers and the healthcare system and say, these are the people you need to engage. To do what? To actually understand who they are, what do they need, and support them. And in doing so, what we've done within this domain is do what Cecilia shared with you, is share the enormous contributions of family caregivers to the care of our patients, clients, or residents, whatever you may call them, across the continuum of care, as well as the consequences of caregiving. The second domain, not any more important or less important, is timely communication with family caregivers. And the third one is partnering with family caregivers. And that has now become, a buzzword across all kinds of work that's going on to support family caregivers, because we've recognized that they are actually partners in care, and that we need to bring them onto the care team, but that's not enough. The next domain is fostering resilience, which is about assessing their needs from their lens. And this is important. What are their support needs? Both for sustaining their caregiving role, which we desire very much as a society and the healthcare system, but also to help them maintain their own health and well-being. Well, assessing support needs is not enough. We also have to help with navigation. And we know 15 to 30% of caregiver time is spent on just navigation the system. And healthcare providers also have a role, particularly navigating the healthcare resources, but they can signpost. And we are doing, we have a major initiative in Alberta, served by our Alberta-based caregiver-focused care coalition called Core Alberta, which is doing exactly that, is helping with system navigation. And healthcare providers need to be party to that system navigation. It is no one person's responsibility, it's all of our responsibility. And finally, enhancing the culture and context of care. We need people like Cecilia who are in managerial positions, who are policy makers. And I'm so glad, Shoshana, to see your policy guidelines, because that is essential. We have to change the culture and context of care if we expect our healthcare providers to do what we are asking for them to do while serving these competencies. Each of these domains further have indicators anywhere from 3 to 5, and the education we develop serve those indicators. I've just given you one example here. Next slide, please. We are in the process of developing 3 levels of caregiver-centered care education. We developed one, which is the foundation education, which has been tested. Over 1,500 caregivers since fall across Alberta have taken the education, rated it very highly. And as I said, we've got over 100 people involved in over 100 people involved in co-designing that work, who are also helping us spread this work. And increasingly, we are seeing healthcare settings and education institutions now either already have made them part of their training or making it mandatory for staff in staff orientation. And thank you again to Healthcare Excellence Canada for including it in their Essentials Together bundles. We have also released the COVID module, as I've said. Now we are in the process of developing, which was our original intent, is advanced education. Now, this is for those staff who spend a lot of time with family caregivers. So these are people like case managers in home care, recreational therapists, social workers, geriatric assessment nurses, site nurses, staff who spend a lot of time with caregivers of children with disabilities, staff who spend a lot of time with caregivers of people with mental illnesses, and so on, as well as managers. This advanced level education, of course, will be a more fulsome education and will take into account further in-depth education around all the clinical indicators within the competency domain. And finally, we have means of developing and recruiting about 60 champions from within the healthcare system now to actually support the dissemination of this work and mentor people in real time within the healthcare system. So stay tuned. The advanced level education will be released by the end of this year. We are currently in the process of developing it. And we are recruiting caregiver-centered care champions as we speak. Next slide. So this education, I just want to let you know, is available free online, caregivercare.ca. We've made it open for public good across the country. Please go on it, test these modules, both the foundation and COVID-19 education for yourselves. And if you find it useful, please help us spread it. Also, if you'd like to join a multi-stakeholder group, it's increasing every day. The numbers are increasing every day in co-designing the advanced level education or champion, caregiver-centered care champions education. Please reach out to us. We'd be happy to have you join us. And we now have a number of provinces who have joined us and who will be then. This is all shared work. It's co-design and it's for everyone. So it'll be yours to take into your setting. Next slide. So what I'm going to do now is I'm going to hand it back to Cease, and she'll take a few minutes to speak about education in practice. How is it that partnering with family caregivers is happening in long-term care? And then I'll speak to some real life experience in home care.
Hi, everybody. So we, at one of the centers that I work at, we really wanted to try to bring together the caregivers and the staff to work together. So we started an initiative called Family Involvement. And as we talked about changing policies, some of that needed to happen because, for instance, you know, we had people move into our center and their family member had been caring for them at home, and they'd been using all the equipment like lifts, doing lifts and transfers, all those things. And then as soon as their loved one moves into the care center, it's like, we're not allowed to do that because the policy doesn't allow it. And that's really all about risk management. So there was risk to the staff, risk to the family members. How are we going to mitigate that? So one of the things we did for our caregivers is we changed the policy to allow the caregivers to be part of the use of the equipment, be the second person on the lift. And we provided the same training, it's a Be Light training, to our family members as we did to our staff. And then we had a little a name tag with the communication that allowed the staff to see that this family member was trained and that they were capable of doing a number of different care activities within our environment. They were always quite capable of doing it, but it was within our environment. And the same thing for our staff. So we needed to provide training to our staff around communicating with families. And that's some of what you'll see in the modules that are on the website that Jasneet spoke of in terms of communicating, listening to families. That's really one of the most important things, is taking the time to hear what's really going on for them, and then taking that information and supporting them the best way that we could to work in partnership, to ensure that they that both sides felt comfortable and confident in their focus and where they wanted to go. With COVID-19, we really very quickly realized that we needed to get the families and the caregivers back into the site. We saw people, you know, their health deteriorating. We communicated constantly with our families at least once a week. When it first started, we were sending out communiques probably 2 to 3 times a week with our family members so that they knew what was going on in the center. And then we looked at very specifically each person and assessed whether it was important that they come into the site. So even though our orders from the medical officer of health were saying that for the most part, you shouldn't be letting people into the site. We really did an assessment on our residents and their family member, and did they need to be together? So was there benefit for that? And if there was, then we made sure that they were able to come in and support at meal times, support communication with other family members. So, Zoom calls, and having the designated caregiver do Zoom calls with the resident and whoever wasn't able to come into the site. I think as soon as we did that, you could feel the environment in the site change again. There was less stress. And I loved watching when family members would come in and the staff were so excited to see them. You're back, and we're so glad you're back. And it really spoke to how the relationships had been built over the year prior to COVID with our family involvement program. So we just really believe that, and I really believe that family are essential, and they need to be part of everything that we do within our system.
Thank you, Cease. And in the interest of time, I'll just very briefly mention that we've introduced this education into home care in the Edmonton zone. And perhaps the COVID pandemic had something to do with it, but the flavor of our focus on our clients has changed, and we are very much aware of the presence of family caregivers. We use the caregiver risk screen to identify caregivers at risk, and we have exponentially enhanced our provision of respite care. And we did a pilot as well as ongoing work, and we are finding that the caregivers are feeling more and more supported, and both the caregivers and clients feel they have a real choice to stay at home. So if anybody's more interested in our pilot work and our home care related work, please write to me. Shoshana, I'll hand it over to you.
Thank you both very much. We now have an opportunity to take a few questions. I see there are some that have come in through the chat box, so I'll read those out to start with. So a question from Jennifer Simon: what was the criteria for assessing need benefit, and how was this assessed in an inclusive and fair way?
So if I understand this correctly, is this question about the co-design process and inclusion of various stakeholders in validating the core competencies? I just want to make sure I've understood the question. And if it is, yes, we made sure there was representation from all key stakeholders. As I mentioned, each of these meetings, symposia, grant-funded work had cross-representation, and we ensured that there was every setting: acute care, primary care, supportive living, long-term care. Oh, sorry, I'm going to wrap up because I think this question is more for Cecilia than it is for me. And home care were represented, as were family caregivers. We made sure 25% of the people at all these meetings were family caregivers. And another point to note is close to 60% of caregivers, our workforce, general workforce, are also family caregivers. So when you have healthcare providers engaged in this work, you're looking at 50 to 60% of them also providing very valuable input. Cecilia?
Yeah, so you're looking for criteria for assessing. So certainly our assessment was, I would say, rather holistic and very individual. And I know that our nursing staff really struggled with this part of the work when COVID happened, because it's not, it's very ambiguous. And so, we were looking at people's physical health. So were they still eating? We're looking at their emotional health. Were they still engaged in life? Were they looking sad? Were they talking less than they used to? so it was really a lot of observation in terms of how the person was doing with some assessment of their physical health. But it most of the time showed up in behavior. So sometimes behaviors would increase, sometimes people became withdrawn. So when looking at it from that perspective in terms of how the person was doing with their mental health, with their psychological health, and with their physical health. And I'll give you an example of a family that we worked extensively with, because there are generational mental health issues in this family. So the person living in the center was somewhat had some anxiety already when they were not able to see their family member. The family members also had a lot of anxiety, and they were phoning us wanting information about their family member constantly. And when we attempted to initially do some Zoom visits, they weren't very effective because there was way too much anxiety happening. So based on that alone, we made an assessment that it was really, really important to get this family member in and start those face-to-face visits so that the person living in the center, their anxiety would be reduced, because they didn't understand why their family member wasn't visiting. They were starting to feel abandoned, right? And the family member couldn't communicate that through a phone conversation or a Zoom conversation. So it really is on a one-to-one basis, and it really is holistic in terms of the assessment that you're doing. Does that answer your question? I think it was Jennifer.
Yeah, thank you. I want to get us to one last question from Virginia Collins, is how this training can be adapted to facilitate persons who are experiencing pregnancy and birth. And maybe I'll just broaden that to other settings, to all settings. How can the staff training be adapted to different settings?
Shoshana, I'm so glad, Virginia, that you asked this question, and thank you for posing it, Shoshana, because when we started building this education, we had the competency domains identified, we had the competency-based framework, and when over 100 people came together to develop this education, what came across was that we have to first develop what we would consider foundational for all healthcare providers, for all settings, supporting all family caregivers. So they did not want us to focus on family caregivers of just older adults or healthcare providers who are caring for family care or interacting with family caregivers with mental illnesses or people with disabilities. They wanted something that would run across the system, because the recommendation that bubbled to the top is that right now we have nothing within the healthcare system that formally introduces healthcare providers even to the term family caregiver. So we then went about, and it took a whole year to produce something that everybody agreed to, that would be foundational for any healthcare provider. It could be an HCA, an LPN, nurse, physician, OT, PT, anyone in any setting who could take this and absorb the competencies that would serve the caregivers well when they interacted with them. So absolutely, Virginia, if you just take the competency domains, the framework, and look at the 6 of them and take the online education, though it is centered around a particular situation, you will get the sense, you will get the healthcare provider taking that education will realize the importance of that domain and the key learnings that are coming from each domain. So there are actually 6 videos to serve the 6 domains, but they're all interconnected, and any healthcare provider can take it. And that's exactly what's happened with our CLPNA, which is the professional organization for LPNs, and now for the HCAs, the healthcare attendants in Alberta. It's gone onto the website for any HCA to take it, for any LPN to take it. And similarly, it's been absorbed into the curricula of occupational therapists, medical students, etc. Thank you, Virginia. Appreciate your comment.
Thank you both for again for speaking, and in closing today, I'd just like to say that everyone should consider registering for Essential Together. There are opportunities for coaching. We've also started a Yammer channel, and we have some upcoming Essential Together huddles. Reach out to us if you haven't received an invitation to the Yammer channel and are interested. Once again, I'd like to thank Jasneet and Cecilia for their excellent presentation today. Thank you to all of the HEC staff and to the interpreters who made this happen behind the scenes. And of course, thank you to our audience for joining us today. As you leave, please take a quick moment to fill in a short poll that will pop up in a moment. And that concludes today's webinar. Have a great day.